Good afternoon, my name is Dakota Nichols. I'm an FNP student at Auburn University. Today we're going to be going through head to toe assessment. Prior to entering the room, patients already had vitals, height, weight, all that is appropriate, everything looks good. Hand sanitizer, all that good stuff. Okay, also for the purpose of this video, patient is going to remain clothed at all times. In a regular assessment, patient would have a gown on. Start with, I'm just observing the patient. No obvious distress, body seems appropriate, no obvious bleeding, trauma, anything like that to be found. I'm going to start with his head, looking at his head. I'm looking at the hair distribution. I'm looking at the symmetry. I'm looking, make sure it's atraumatic. I'm going to palpate his hair, do the texture. Hair texture is coarse, thick hair, appropriate for patient. Also going to palpate for any tenderness, any types of lumps, anything like that. Patient has no lumps, tenderness, anything of that nature. Going to look at the patient's eyes. Patient's eyes are symmetrical, eyebrows are symmetrical. Patient's sclera is white, it's appropriate. Pen and light. Look straight ahead. Shining the light in. Pupils are reactive to light. Follow this straight into your nose and they're accommodating patient's perla. We can also pull eyelid down. Good pink conjunctiva is what you want. You can also move into the internal eye exam. Okay, going, got the red light reflex, gonna move in, the ball looks good. Like I said, no obvious scrapes, abrasions, anything like that. Okay. Looking at the nose now, look up for me. Well, first you can look at just the symmetry. Slightly asymmetric. Patient has a history of a broke nose. It's an expected finding. Look straight up for me. With a history of the broke nose, patient's septum is still midline, no deviation. Blow out that other nostril. Blow out that other nostril. Patient's snares are intact. Excuse me. All right, we're gonna move on to the ear exam. Looking at the ears. There we go. You can look at the outer ear. The outer ear is atraumatic. Compared to the other one, it is symmetrical. Pink, no obvious like redness, irritation on the outer parts. Take a look inside. Minimal amounts of earwax is noted. You got a good light reflex. And again, no redness, swelling, irritation, nothing like that. Also, we'll have patient close your eyes. What do you smell?
Peppermint.
Boom, peppermint chapstick, just like that. All right. I'm gonna assess the patient's TMJ, open and close. Okay, we didn't have any type of crepitus, no crunching, clicking, anything like that. Joint is intact. Go ahead and open up your mouth for me. Take a look inside. It's pink, mucosa, everything looks good. No obvious dental problems or deformities. Stick that tongue out. Move that tongue side to side. Okay. Also, normally at this point, I'd test gag reflex. I'm not going to put him through that. We're going to just assume his gag reflex is intact. Okay. At this time, we can assess for lymph nodes. No lymph node, any of that tender up under there, levator, submandibular, submental. And you can follow it down with the posterior and anterior cervical chain. Nothing there. No tenderness there. Awesome. Okay. We can also do visual acuity. If you're doing the visual acuity card, the patient has it 14 inches away from their eyes. If you're doing like a full size, it's 20 feet away. We're gonna pretend this one is a small card, and we're gonna do 14 inches away from the patient. And the patient will read the lowest line that he can read with his right eye covered up.
Line number 10 is FDPLTCEO.
Okay, cover up your left eye.
Line number 10 is FDPLTCEO.
Boom, at both eyes.
Line number 10 is FDPLTCEO.
Sweet. All right, so his vision is 20/20. Okay. Next, we're going to make sure that his hearing is symmetrical, which is, we'll place this right here. Do you hear that evenly in both ears?
Yes.
That's an expected finding. Also, we can do a whisper test where I close this ear and have him repeat what I say.
1, 2, 3, 4.
Sweet, okay. Next, we want to make sure that we want to make sure that air conduction is greater than bone conduction. Tell me when you stop hearing that.
Okay.
Tell me when you stop hearing it now. Okay, all right. Expected finding, air conduction is greater than bone conduction for that. Let's see. Head, ears, eyes, nose, throat. Lymph nodes, we did. Tonsils were not swollen. Pupils also were a 3, which is expected finding. We can also, while we're on the throat, we can go ahead and do the neck. Have the patient, we'll have the patient swallow. I'm going to tell you to. Trying to feel, go ahead. Feeling for any type of nodules on the patient's thyroid. Okay. Moving on. We're going to, let's see. We're going to, all right, we're going to assess the patient's back. Again, looking, patient would have shirt off. You're looking for symmetry, skin color, texture, any obvious deformities, anything like that. No obvious deformities. Everything looks appropriate. So after inspection, we can palpate. Any tenderness?
No.
No? Okay. Go. We can have the patient say 99.
99.
99.
99.
99.
99.
Okay, tactile firmness, all that is appropriate. Have the patient take a deep breath. Okay, good. It's good lung expansion, it's symmetrical. We can palpate as well. Okay. Okay, patient's moving air well, no wheezing, anything like that would come up. Looking at the front, looking for any type of bony deformity, any abnormality like that. Always skin color, texture, temperature, any hair distribution, everything like that. Also can palpate up in here, any tenderness in through there. No tenderness, that's expected finding. Put your hands right at the base of the patient's ribs, right about the diaphragm. Take a deep breath in and let it out. All right, good lung expansion again, and it's symmetrical. Patients in no respiratory distress, not using any accessory muscles to breathe, anything like that. We can go ahead and do the, say 99.
99.
99.
99. 99.
Okay, that's good. All right, go ahead and take a listen. Deep breath. And you want to make sure when you're auscultating your patient that you account for anatomy, and the right lobe has the 3 lobes, that the middle lobe cannot be heard from the backside. So you want to make sure that you catch that as well. Okay. We'll move on to the cardiovascular assessment. Looking at blood flow. Patient's got good capillary refills. Also, we check toes if patient has shoes on. Good blood flow. We can go ahead and check pulses here. Pulses are equal and strong. They're about a +2, which is an expected finding. You can also do the brachial. You can do carotid. Only do carotid one at a time. Watch patient pass out if you try to hit them with both at the same time. You can also, at this time, we can also auscultate the carotid as well. And you can also auscultate the temporal as well. Okay. Now we're going to heart sounds. And you'll also listen to all your heart sound spots with the bell and the diaphragm. The smaller part of the bell will be listening for any types of murmurs or clicks, any type of abnormal heart sounds you might be able to hear better with this one. Okay, we had a good S1, S2 at all 5 spots, and that's going to be your aortic, pulmonic, Erb's point, tricuspid, and then mitral. Good strong pulse everywhere through that. Also, we can go ahead. When we did the pulses, cap refills. We'll check the lower extremity pulses later on in the assessment. Okay. So at this time, I'm gonna have the patient go ahead and lay back. While I have them lay back, I'm gonna also listen to the heart sounds again, just because laying flat can shift some of the anatomy as well as fluid around and cause different heart sounds. Same 5 spots. While I have the patient laying flat, we'll assess the abdomen. You're looking for any pulsations. Again, skin color, hair, texture, temperature, all that is appropriate. Once you've inspected, you're going to auscultate first, just because the percussion and palpation can alter what you hear. So you're going to want to make sure you do auscultate all four quadrants for bowel sounds. You're also going to want to auscultate the epigastric area as well for like the fifth sound. Okay. And while you're auscultating that, you can also auscultate your aorta, renal arteries, and your iliac arteries as well. Okay. Go ahead and we can percuss now. Percussion will allow you to detect any type of hyperresonance that might be from fluid buildup or any number of abdominal complications. We're gonna go ahead and palpate. Start with light palpation in all four quadrants. Any tenderness? No tenderness. We can also have the patient take a deep breath in and palpate underneath the rib cage for the liver. Any tenderness there?
No.
Liver feels to be an appropriate size. We can also attempt to palpate the kidneys. Unable to palpate the kidneys in this patient. That's not an abnormal finding. It's just you can't always feel them depending on the patient. Also, a regular assessment, I would also palpate the bladder and do a full male reproductive exam, but we're not, for the sake of the video, we're not going to put him through that as well. Okay, come on up, just watch your head. Okay. While we're still up on this half, I'm going to have the patient go ahead and demonstrate range of motion. Have you hold both arms out, bring them to the side, cross them. Okay, bring this arm behind your back. Okay, this arm behind your back. All right, stick your hands straight out again. Turn your arms over. Bring your wrist in, wrist down, wrist out both sides. Bring your elbows, or bend your elbows, straighten out your elbows. Okay, got good range of motion there. Go ahead and squeeze both fingers. Boom, strength's good there. Try to raise your arms up against me. Try to bring them down against me. Okay, same with your bicep. Now try to bring it up. Okay, try to push it down. Okay, and you're gonna assess that bilaterally as well. We can go ahead, yeah, and push down. Have patient shrug up the shoulders. Awesome, turn your head that way. Now try to bring it back to me. Okay, turn your head that way. Try to bring it back to me. Okay. And wiggle all your fingers around, all that. No obvious deformities there. You're looking at the arms, you're looking at the skin color, texture, hair pattern, any types of abrasions, anything like that as well. Let's go ahead and have you lay back real quick and we'll just knock out the rest of that. Go ahead and just raise this leg up against resistance. Bring it down against resistance. Push against my hand. Pull. Okay, same with both legs. Come back on now. Okay, got that. We can go ahead and test good old reflexes as well. Start right here. There. Okay. Okay. Get the bicep reflex. Now for the, here, come this, make it a little easier, trying to let that arm kind of free hang. But anyway, that was a good one. That was a good one. Okay, we can go ahead and do the patellar as well. Alright. I mean, that's borderline. That's borderline hopper right there.
I don't like those.
That'll be noted in the documentation. Alright, relax your foot. Try to get the Achilles. You got that one good. And then also we would test for Babinski. His toes do not fan. Expected body. Okay. So we can do some of the more sensory type stuff now. Let's see. Close your eyes. What I put in your hand?
Paperclip.
Sweet. All right, keep your eyes closed. Let me see your left hand. What number am I drawing in your hand? What number?
7.
There you go. All right, keep your eyes closed. We're gonna say that, soft, hard.
Okay.
Soft and sharp, okay? Sharp, soft.
Okay.
All right,
Soft.
okay,
Sharp.
okay,
Soft. Sharp.
okay,
Sharp. Soft.
okay,
Sharp. Soft.
okay,
Sharp. Soft.
okay. Awesome. You can open your eyes back up now. Let's see. Let's go ahead and do some. All right. Put your feet together. Scoot over that way just a little bit. All right, feet together. Arms out to your side. Close your eyes. That's the Romberg. He passes that. No swaying. That's what you want. Okay, you can open your eyes back up. Just walk down that way a little bit. Just normal walking. You can assess their gait, any type of impairment there. Come back and walk to me. Do heel to toe this time. Boom. Heel to toe is good. No problems with balance, coordination, all that. Go ahead and take a squat for me. Squat down good, just like that. All right. Stand up on your tiptoes. Walk on your tiptoes. There we go. Boom. All right. No problems with that either. Let's see. Let's go ahead and we can do some of the rapid movements. We're gonna have you take both hands, slap them here twice, and go back twice, twice, twice. Okay, boom, pass. All right, I want you to touch the tip of your nose with your finger and then touch the tip of my finger.
With the same hand?
Yes. Okay. Focus point touching is good. It's appropriate. Let's see. Okay. Trying to think. We did the cranial nerves. We did your tongue side to side. We did shoulder shrugs, neck movement. We did eyes, the acuity. We did smell. Let's do field of vision while you're standing up. So cover your left eye with that hand. Okay, tell me when you see my fingers coming into vision.
I see him. I see him.
Okay, let's do the other hand.
I see him. I see him. I see him.
Okay. And follow my fingers straight. patient's able to follow all fields of vision. Okay, I feel pretty good about that. We're gonna